Hi, I'm Dr. Rich, and I'm going to give you 5 questions to ask your dentist before you get dentures. So, if you are someone that's thinking about getting dentures, whether immediate dentures or regular dentures, or do you have a family member or loved one who is in that position, this video is going to be for you. So, and for this, I'm going to skip over the whole fact of whether or not you should actually get your teeth pulled. I'm just going to assume that you made the decision to get dentures and you need to get your teeth removed. So we'll go from there. So the first question you need to ask your dentist is, am I going to get immediate dentures or regular dentures? So the big difference between immediate dentures and regular dentures are that immediate dentures means you still have some teeth in your mouth while the dentures are being made, versus regular dentures, you have all your teeth removed first, then the dentures are made. I have a video that I made called What is an Immediate Denture that goes into more details between the two. So if you're interested, you can check that out. I'll leave a link up this way or somewhere, or down, definitely down in the description. But basically, a lot of people tell me it's like they're not sure what they're getting, whether they're going to be immediate, whether or not they're going to get regular dentures. What are the pros and cons of each? To sum it up, with immediate dentures, you're always going to have teeth in your mouth, whether it's your own teeth, and then then you'll get the teeth pulled and the denture fit right then. So you're never going to have a mouth with no teeth at all. Downsides to them is you can't check how they're going to look before you pull out all the teeth and fit the dentures in, since you can't fit them in your mouth to try them in, doing a wax try-in. And then secondly, a lot of times the fit of them is not going to be very good in the beginning, and it's going to get worse over time. They're going to get looser after you have all your teeth pulled and the jawbone shrinks. So once that happens, then 6 months down the road, you can get them relined or a new set made. And then in some cases, immediates may not even be an option. If you're somebody who's losing a lot of, losing their teeth due to periodontal disease, I've had patients come in with such bad gum disease that their teeth are so loose, there was no way I could take an impression of their mouths without pulling the teeth out during the impression. So in those cases, we usually elect to remove all the teeth first, let them heal for a bit, then make the denture. And they end up with a better fit and much better aesthetics. So something to talk about with your dentist, definitely. Question number 2, if you decide to get immediate dentures, how are they going to be made? Are they going to be the final set, meaning that they make this one set of dentures and that's the ones you have? Or are they going to be considered a healing set of dentures, where basically your dentist will make a set that's a little bit less expensive maybe, or just a little quicker, pull all the teeth, fit those in, and you only wear those for the 6 months or so that your gums are healing and shrinking. And then once your gums have healed up, your jawbone has shrunk as much as it's going to continue shrinking over the rest of your life. But in the beginning, it's where it's going to shrink the most. And then at that point, you make a final set of dentures. But again, this is something you need to discuss with your dentist before you start the procedure, because a lot of people get surprised that they get a set of immediate dentures. They're not happy with how they look. They're not happy with the fit. And they're surprised that 6 months down the road, the dentist is like, all right, we can make you a new set and it's going to cost you this amount of money. And people are shocked by that. So always ask ahead of time, how is the process going to work? Am I going to be making one set? In some cases, I've had people come in especially people who've had partial dentures for a long time, where they still have a few teeth left, but they've been missing teeth for a long time. In those situations, I can usually make them a set of immediate dentures that, once I reline them 6 months after pulling their teeth, they actually work very well for them, and they're comfortable, they look good, because they had so few, they didn't have that many teeth already. They had a lot of teeth missing already that we're able to work around them and get a good result. And then on the other hand, you have people who come in with a mouthful of teeth, say they're all really broken down due to cavities, and they want a set of immediate dentures. In that case, again, I try to pull most of the back teeth first, try to work around it, but I can't guarantee that the aesthetics are going to look well. look very good or that the fit's going to be very good. So in those cases, I'm more likely to recommend a healing set of dentures first, followed by a final set of dentures 6 to 12 months down the road. Question number 3, how much is it going to cost? What's included in the cost? You can't just go by off how much does a denture cost. So if you someone going in for dentures, there's going to be a lot of costs involved. There's the exam and any x-rays that are needed, any extractions, teeth, how many extractions, how much that's going to cost. Again, if it's going to be a immediate denture plus a reline down the road, make sure that the reline's included. Or if it's a healing denture and a final denture down the road, discuss those costs as well. Make sure all those costs are discussed, because again, some people don't realize that immediate dentures, you need the reline, and they get surprised by that extra expense. When I present my cases to patients, I include the reline fee in the case fee, just so that they know exactly what's involved in the case going forward, so that 6 months later, when it's time for a reline, it's not a surprise. The patient's expecting it, and they're more willing to do it that way. And then same thing if we're making a final set of dentures. Again, we lump that into the case fee as well, so that again, when they do it, there's no surprise. Because I get a lot of I get a lot of comments from viewers saying that they're surprised by the cost. They had a set of immediate dentures made and don't realize that 6 months later, what they have to pay for a reline, they have to pay for a new set. So again, discuss all that with your dentist before you commit to any treatment, just so make sure everybody's on the same page. Okay, question number 4, how will adjustments be handled? Again, this is going to depend from office to office. For instance, in my office, any denture adjustments, I include them in the case fee. And I always tell people the day they get their denture, that's not the end of their treatment. That's more like the middle point of their treatment. Because now that they have the denture and they start wearing it and using it, speaking with it, they have to learn to speak with it, learn to chew with it. There's going to be adjustments. Their mouth's going to adjust to it, and then the denture itself needs to be adjustments. There'll be sore spots. Sometimes the flange could be a little long, so we got to shorten it. Sometimes we got to reline it. Again, some people need soft relines during the healing phase with immediate dentures. And again, that needs to all be discussed ahead of time, so you know what's going on. So like I said, in my office, I tend to include all that. Other offices I've heard will give you X number of adjustment visits, say 3 visits, 5 visits, and then after that, if you need any more visits, you have to pay for each adjustment visit. So again, just to discuss it with your dentist before you commit to treatment, so that you know what's going to happen later on. Question number 5, how natural will they look? In my office, when we pick our teeth for the dentures, I let the patient pick whatever color teeth they want. We get a different size teeth depending. Some people have small teeth, some people have large teeth. We try to select teeth that kind of fit their face and the size of their face. And also male teeth tend to be a little bit more square looking. Females tend to have a little bit more softer, rounded looking teeth. So that's something that can be adjusted. And then even the placement of the teeth, we can change that around. Some people want to have perfectly straight teeth. They tell me, I'm like, doc, this is the first time I can have perfect, beautiful teeth in my whole life. So that's what I'm going with. Others want them to look a little more natural. I've had people who had crooked teeth their whole life. So when we made them a set of immediate dentures, we made them a little bit crooked, little twists and little spaces. Several patients had diastemas, spaces between their front teeth, kind of like I do. And we replicated that in their final denture. I remember one gentleman, after we added it in, he, during one of the adjustment visits, he actually asked me to make it a little bit wider because it wasn't quite how he looked when he had his regular teeth. And then question number 6, this is the bonus question. What will happen if I don't like the dentures? What if I can't chew with them? What if I can't eat with them? What if I don't like how they look? So this is something that people don't really like talking about. Both the dentist in the office and the patient doesn't really like talking about it, because some people think that's going to assume that well, you're kind of presupposing it's not going to work out, and so it's better if we don't mention it. We're just going to make everything happy. But again, things happen, stuff happens. So again, discuss it with your dentist as to what'll happen in those situations. A lot of cases, there's not going to be any refund offered because there was a lot of work. The work was done, and it's how it is. Other cases, they'll offer you a partial refund. But again, it's going to vary from dentist to dentist and your situation. Some patients, though, too, are just not people who can deal with having removable dentures. They'll move around too much, and they're never going to be happy. In those cases, that's a question you have to ask yourself. Maybe implants or snap-in dentures on implants or fixed implants, like an all-on-4, would be a better option for you. Unfortunately, a lot of people don't realize that until they're in the situation where they have the dentures in their mouth and they realize, oh, these are two big pieces of plastic that I'm trying to chew with. So again, unfortunately, it's one of those areas nobody likes talking about it, but if you talk about it a little bit ahead of time, just so everybody can realize the expectations, so the dentist will know your expectations. You can hear from the dentist as to what they can reasonably provide for you too, because dentures are not teeth; they're a replacement for teeth. So they're pieces of plastic that are in your mouth that you chew with. All right, thank you all so much for watching this. I really appreciate all the questions and comments. For this video, please leave them below. I try to answer every single comment and question I get. Thank you all so much for watching, and I'll see you in the next video.